High blood pressure often develops without any symptoms, yet every heartbeat can silently damage your arteries and vital organs for years before you even realize it. Blood pressure measures the force of blood pushing against your artery walls. 120/80 represents the pressure while your heart beats and while it rests. Doctors classify blood pressure into different ranges. As the numbers rise above normal, your heart and arteries experience increasing stress, raising the risk of serious health problems. Hypertension is called the silent killer because most people feel completely normal while hidden damage slowly develops inside their arteries and vital organs. High blood pressure doesn't affect only your heart. Over time, it can silently damage your brain, kidneys, eyes, and blood vessels throughout your entire body. High blood pressure can develop because of aging, genetics, unhealthy eating, stress, or physical inactivity. Several risk factors often work together. Healthy arteries expand with every heartbeat. When arteries become stiff or narrow, your heart must pump harder, causing blood pressure to rise. Even a gradual rise in blood pressure can increase the workload on your heart. The higher the numbers climb, the greater the stress placed on your arteries and vital organs. When blood pressure stays high, your heart must work much harder with every beat. Over time, this extra strain can cause the heart muscle to become thicker and less efficient. Constant high blood pressure injures the inner lining of your arteries. Over time, these tiny injuries make it easier for plaque to build up and restrict healthy blood flow. Uncontrolled high blood pressure is one of the leading causes of stroke. It can block blood flow to the brain or weaken an artery until it suddenly bursts. High blood pressure also increases the risk of a heart attack by damaging coronary arteries, allowing plaque to build up and reducing the blood supply to the heart muscle. Your kidneys contain millions of tiny filters that are easily damaged by high blood pressure. Over time, this can reduce kidney function and increase the risk of chronic kidney disease. High blood pressure can also damage the tiny blood vessels inside your eyes. Over time, this may blur your vision and increase the risk of permanent vision loss. Healthy blood pressure allows your heart and arteries to work efficiently. High blood pressure forces your cardiovascular system to work much harder every single day. Although arteries naturally become less flexible with age, uncontrolled high blood pressure speeds up this process and places even greater strain on your heart and blood vessels. Checking your blood pressure is quick, painless, and one of the best ways to detect hypertension before it silently damages your heart, brain, kidneys, and blood vessels. One high blood pressure reading doesn't always mean hypertension. Doctors usually look for consistently elevated readings taken on different occasions before making a diagnosis. Regular blood pressure monitoring helps identify changes over time. Tracking your readings can help detect hypertension early and support timely medical evaluation. The good news is that high blood pressure can often be controlled. Early detection and the right treatment help protect your heart, brain, kidneys, and blood vessels. High blood pressure is not just a heart condition. It affects nearly every organ that depends on healthy blood vessels and steady blood circulation. Over many years, uncontrolled high blood pressure can permanently damage artery walls, making them thicker, narrower, and less flexible, which further increases cardiovascular risk. High blood pressure also increases the risk of heart attacks by damaging coronary arteries and making dangerous blockages more likely to develop over time. Hypertension is one of the leading causes of stroke because excessive pressure can damage brain arteries, allowing them to become blocked or rupture unexpectedly. Your kidneys depend on tiny, delicate blood vessels to filter waste. Uncontrolled high blood pressure can damage these vessels and gradually reduce kidney function over time. High blood pressure can also damage the tiny blood vessels inside your eyes. Over time, this may affect your vision and increase the risk of permanent eye damage. Healthy lifestyle choices can significantly reduce blood pressure. Eating well, staying active, sleeping enough, and avoiding tobacco all help protect your cardiovascular system. The best way to fight high blood pressure is prevention. Regular checkups, healthy daily habits, and early treatment can greatly reduce the risk of serious complications. Managing high blood pressure requires consistent, healthy habits and following your healthcare provider's advice. Small daily actions can make a big difference over time. Knowing your blood pressure today could help protect your health for years to come. Early awareness and consistent care are the strongest defenses against hypertension. Keeping blood pressure under control greatly reduces the risk of heart disease, stroke, kidney damage, and many other serious health complications. Simple daily habits can make a real difference. Healthy eating, regular exercise, quality sleep, stress management, and following your treatment plan all support healthier blood pressure. Blood pressure naturally changes throughout the day. Persistent high readings over time, rather than temporary increases, are what healthcare professionals evaluate for hypertension. While age and family history cannot be changed, many important risk factors for high blood pressure can be improved through healthy habits and proper medical care. Checking your blood pressure regularly and acting early can prevent serious complications. Prevention and consistency remain the best long-term protection against hypertension. Knowing your blood pressure is one of the simplest steps you can take to protect your future. Thank you for watching Health Horizon. Stay healthy, stay informed, and we'll see you in the next documentary. What if the greatest threat to your health wasn't something you could see or even feel? Right now, high blood pressure may already be silently changing your body without you even realizing it's happening. That's exactly why doctors call it the silent killer. Most people feel completely healthy every single day, often for years before the very first warning signs finally begin to appear. Imagine your blood traveling through thousands of miles of blood vessels every single day. When pressure stays too high against those delicate artery walls, that damage doesn't happen overnight. It slowly builds over many years, forcing your heart to work harder with every beat until even place more strain on your entire cardiovascular system. Your heart never gets a day off. When blood pressure stays high, it must pump harder every second to move blood through narrowed arteries. Over time, this constant extra effort, eventually overworked heart begins losing its strength. As pumping becomes less efficient and other life-threatening complications to rise, even if you still feel perfectly healthy every day. High blood pressure doesn't only threaten your heart, it can also damage the delicate arteries that supply your brain, increasing the risk reducing healthy blood flow long before any obvious symptoms appear. If one of these weakened blood vessels bursts or becomes completely blocked, brain cells begin dying within minutes. That's why a stroke is a true medical emergency where every passing second Your kidneys are filled with thousands of tiny filters that clean your blood every minute. Constant high blood pressure gradually damages these delicate filters, reducing High blood pressure can also injure the tiny blood vessels inside your eyes, gradually affecting vision before many people notice anything is actually wrong. High blood pressure doesn't damage just one organ. It silently affects your heart, brain, kidneys, and eyes, often years before symptoms become impossible to ignore. The good news is high blood pressure can often be detected early and managed. Checking it regularly could protect your heart, brain, kidneys, and future. Many people with high blood pressure feel completely normal. That's exactly what makes this condition so dangerous, because it often develops without noticeable symptoms. Damage often begins years before symptoms appear. By the time warning signs develop, your arteries, heart, or other organs may already be affected. Too much salt, smoking, chronic stress, and physical inactivity are common risk factors that gradually increase blood pressure and silently damage your arteries. Eating too much sodium makes your body retain extra fluid, increasing pressure inside your blood vessels and forcing your heart to work harder every day. Smoking damages blood vessel walls and reduces their flexibility. This makes blood pressure rise faster and increases the risk of serious cardiovascular disease. Carrying excess body weight forces your heart to pump harder, increasing blood pressure and placing continuous stress on your arteries and cardiovascular system. Chronic stress keeps your body in a constant state of alert. Over time, this can raise blood pressure and increase strain on your heart. Poor sleep prevents your body from fully recovering overnight. Over time, it can contribute to higher blood pressure and increased cardiovascular strain. You cannot change your age or family history, but knowing these risk factors helps you monitor your blood pressure before serious complications develop. Regular blood pressure checks help detect problems early, giving you the opportunity to make changes before permanent damage develops inside your body. Healthy eating, regular exercise, and routine blood pressure checks can significantly lower your risk and help protect your heart for many years ahead. But dangerous myths still prevent many people from seeking help. Next, we'll separate medical facts from fiction and reveal important warning signs. Many people believe dangerous myths about high blood pressure. Unfortunately, these misconceptions often delay diagnosis and increase the risk of serious health complications. Feeling healthy does not mean your blood pressure is normal. Serious damage can quietly develop for years. This happens without symptoms. Do not wait for discomfort to take action. Most people have no symptoms, but dangerously high blood pressure can cause severe headaches, blurred vision, dizziness, or shortness of breath, requiring immediate attention. A blood pressure reading above 180/120 may signal a hypertensive crisis and requires immediate emergency medical evaluation. For accurate results, rest quietly before measuring. Keep your arm at heart level and avoid talking during the blood pressure check. One reading alone may not tell the whole story. Measuring blood pressure on different days helps your doctor identify a consistent pattern. Some people have higher readings only in medical settings because of anxiety. Home measurements can give your doctor a more complete picture. Understanding your blood pressure numbers helps you recognize problems early. Knowing your results allows you and your doctor to take timely action. Treatment depends on your individual health and blood pressure level. Your healthcare provider may recommend lifestyle changes, medication, or a combination of both. The best treatment is preventing damage before it begins. Next, you'll discover simple daily habits that can protect your heart and lower risk. One proven eating plan is called DASH. It focuses on fruits, vegetables, whole grains, and lean proteins to naturally support healthier blood pressure. Most sodium comes from packaged and restaurant foods, not your salt shaker. Choosing fresh meals more often can help lower blood pressure naturally. Regular physical activity strengthens your heart and improves blood flow. Even 30 minutes of brisk walking most days can make a meaningful difference. Losing even a small amount of excess weight can reduce blood pressure. Every healthy step helps your heart work more efficiently every day. Smoking damages blood vessels, and too much alcohol raises blood pressure. Avoiding tobacco and limiting alcohol greatly supports long-term heart health. Chronic stress can raise blood pressure over time. Deep breathing, relaxation, and mindfulness help calm your body and support healthier blood pressure. Poor sleep increases the risk of high blood pressure. Getting 7 to 9 hours each night helps your heart recover and stay healthier. If your doctor prescribes medication, take it exactly as directed. Consistency helps control blood pressure and reduces the risk of dangerous complications. Check your blood pressure regularly, even if you feel healthy. Early detection allows small problems to be treated before they become serious. Healthy habits work best when practiced together every day. Small, consistent choices protect your heart and help keep blood pressure under long-term control. Knowledge saves lives when you act on it. Next, we'll build a simple daily routine to help protect your heart for years ahead. Protecting your heart starts with simple daily habits. A consistent routine can help keep blood pressure under control and reduce future health risks. Start your morning with a balanced breakfast, rich in fiber and low in sodium. Healthy choices early can support better blood pressure, all day. Drink enough water throughout the day to support your body's normal functions. Healthy hydration works alongside good nutrition and other heart-friendly daily habits. Checking your blood pressure at home helps track changes over time. Share your readings with your healthcare provider during regular visits. Taking medication exactly as prescribed helps keep blood pressure under control. Never stop or change your treatment without talking to your healthcare provider. A relaxing evening routine improves sleep and lowers stress. These simple nightly habits help your heart recover and support healthier blood pressure over time. Seek emergency medical care immediately. For severe chest pain, stroke symptoms, or extremely high blood pressure, fast treatment can save your life. Healthy eating, daily movement, quality sleep, and regular monitoring work together. Small, consistent habits can protect your heart for many healthy years. Every healthy choice you make today builds a stronger future. Protecting your blood pressure now helps you enjoy a longer, healthier, and more active life. Your next blood pressure check could change your future. Take action today, share this knowledge, and help protect yourself and the people you love.